Next up, we're looking at portal circulation. So when we're talking about portal circulation, we're talking about the blood vessels and supply of blood flow to the liver and the surrounding adjacent abdominal organs. So this is another image that shows you how the different portal vein and portal artery come into the liver and then it branches off. You also have the common bile duct off the gallbladder that also follows this pattern as well. They all run right alongside each other. Remember, the liver is a highly vascular organ. Its main job is filtration, so there's a lot of blood vessels and capillaries in the liver. Cirrhosis is when we're going to have irreversible liver damage. It goes through phases of inflammation, which causes cell death, and then the cells change over into fibroids and scar tissue. It leaves behind nodules. Any tissue that has a nodule in it or scar tissue is less likely to have normal function, which means in the liver then that the circulation can't flow through, so blood can't get filtered. Cirrhosis is the end stage of chronic liver disease. So you can have chronic liver disease from a variety of different causes, things like viral hepatitis, alcoholism, toxin exposure, or even biliary obstruction. This is what a normal healthy liver should look like, dark red with the different lobes. Right, this is what one that has all the nodules from end-stage cirrhosis and liver failure in it looks like. The scarring interferes with the vessels for blood supply or vascular flow, as well as biliary flow as well, too. This results in bile staying or getting stagnant in the vessels instead of being able to go through the liver and aid in filtration. And then the blood vessels, the pressure backs up in them to cause portal hypertension. Right, the pressure increases in the portal vein, causing the hypertension, and then fluid cannot get filtered through the liver, so it backs up into the peritoneal cavity, or the peritoneum. That's known as ascites. The backup of the hypertension can also go into the blood vessels of the esophagus as well, and it can cause problems called esophageal varices. One of the main concerns with cirrhosis is that it cannot filter out toxins, particularly ammonia, and if those levels get too high, then it can lead to complications like brain swelling, which is known as hepatic encephalopathy. Cirrhosis, whenever we do a physical exam, we'll notice some different things. One is that the liver can be hard or firm whenever it's palpated. Sometimes it's also enlarged. Symptoms include, early on, patients are going to have weight loss and weakness, loss of appetite such as anorexia, and abdominal pain. As it progresses and gets worse, the symptoms also worsen. They'll get jaundice, which is yellowing of the skin, ascites, their liver and spleen will get enlarged, and splenomegaly and hepatomegaly. They'll get the esophageal varices. They're at high risk for bleeding disorders because your liver also creates your clotting factors for your blood, and they can have encephalopathy. So portal hypertension, normally we have venous blood from the GI tract that gets dumped in to the portal vein, and then it goes to the liver to go through circulation and get filtered. Portal hypertension develops whenever the nodules or scar tissue is blocking the blood flow or obstructing it, so it can't get out of the vessel and into the liver. That backup then of blood causes the pressure to increase and causes hypertension there. If it's not treated, then it's going to lead to other complications. So esophageal varices are whenever the veins of the esophagus become very distended. And what happens is that they're high risk of bleeding. And I'll show you an image in a minute of those. Splenomegaly is secondary to the high pressure in the splenic vein, because if it can't get into the portal vein, then it backs up into the splenic vein and then into the spleen. Ascites is accumulation of fluid in the peritoneal cavity because it can't drain out of the liver. And hepatic encephalopathy happens because since blood can't get through the liver to be filtered, it stays in circulation and those toxins remain. As they remain behind, they're going to continue to have higher and higher levels and build up in the blood. And once the toxins reach high levels and get to the brain, they're going to cause central nervous system disturbances. So this is an image of the esophageal varices. This is somebody's esophagus. Your blood vessels should be nice and flat, smooth to the surface. Alright, these ones are distended. That's the esophageal varices. What happens is as somebody swallows food, it comes through here and scrapes on those, and they're at high risk for tearing open. And since these patients also have disturbances with their clotting factors, they'll bleed very easily. Ascites is whenever there's fluid accumulating in the peritoneal cavity. It's a result of portal hypertension, and your liver also is not able to. The liver is also in charge of creating albumin or plasma proteins to help with osmosis and fluid within the body. Since albumin levels are going to be low, since the liver can't make them, and the portal hypertension forces the blood pressure to be high and blood not to be able to be filtered, it causes fluid to accumulate in the abdomen instead of being filtered. Patients will experience weight gain from the extra fluid they're carrying. Their abdomen will be distended, meaning that it will be further out than it should. If we measure it, their abdominal girth is going to also be bigger than usual. And eventually, if it gets too bad, the fluid can actually push up on the diaphragm, which will make it difficult for their lungs to expand and breathe, and they'll complain of dyspnea as well. So this is a patient who has abdominal ascites. You can see here all this extra fluid that's accumulated in the abdomen. So if you were to do a physical exam on somebody who has ascites, you would palpate the abdomen, and what would happen is it would look almost like and feel like if you poke a water bed, where you can feel that fluid moving under the surface. The same thing happens here because it's all extra fluid under the muscle and tissue layers that you can see moving. Also notice that their structure, right, when you're examining patients. This patient, for instance, is very frail, right? We wouldn't expect them to be obese based on their frame size, and that can give you an indication that it's fluid versus adipose tissue. The next video will pick up with hepatic encephalopathy for you.